Introduction to thorax. The thorax is the upper part of the trunk extending from the root of the neck to the abdomen. It extends from the root of the neck to the abdomen. The cavity of the trunk is divided by the thoraco-abdominal diaphragm into an upper part called the thoracic cavity and the lower part called the abdominal cavity. The diaphragm divides the thoracic cavity from the abdominal cavity. The thoracic cavity contains the principal organs of respiration called the lungs, which are separated from each other by a bulky movable mediastinum. Lungs separated from each other by bulky movable median septum called the mediastinum. The principal structures in the mediastinum are heart and great vessels. Now, what is apex beat? Apex beat, it is a visible and palpable cardiac impulse in the left fifth intercostal space, 9 centimeters from the mid-sternal line or medial to mid-clavicular line. Apex beat जो रहती है बच्चों, it is a visible and palpable cardiac impulse in the left fifth intercostal space, 9 centimeters from the mid-sternal line or just medial to mid-clavicular line. It is visible and also palpable cardiac impulse, called as apex beat of the heart. External angle of Lewis. What is the external angle of Lewis? It is felt as a transverse ridge about 5 centimeters below the supraesternal notch. सुप्रास्टर्नल नॉच के 5 सेंटीमीटर बिलो एक ट्रांसवर्स रिज है जो कि मेन्यूबिडियो एक्सटर्नल जॉइंट marks the manubrial external joint and lies at the level of second costal cartilage. It is very important landmark because the ribs are counted from this level. Ribs are counted from which level? From the angle of Lewis or external angle. The ascending aorta ends at this level. External angle of Lewis. The arch of aorta begins and also ends at this level. आर्च ऑफ एओर्टा बिगिन भी होता है एक्सटर्नल एंगल पे और एंड भी होता है एक्सटर्नल एंगल पे. The descending thoracic aorta begins and ends at this level because the arch of aorta ends at this level. So descending thoracic aorta begins at this level. The trachea bifurcates into two principal bronchi at this level at the angle of Lewis. The azygous vein arches over the root of lung and opens into the superior vena cava. So these are some important events which are takes place at the external angle of Lewis, which is very important surface landmark. Thorax form the upper part of the trunk. ये तो हो गया बच्चा external angle known as thoracic. Now skeleton of thorax, it is also known as thoracic cage. It is an osteocartilaginous elastic cage. This is the thoracic cage. Anteriorly, it is formed by sternum and laterally by 12 pairs of ribs and posteriorly by 12 thoracic vertebrae and intervening intervertebral disc. This is the thoracic cage, which is primarily designed for increasing and decreasing the intrathoracic pressure so that air is sucked into the lungs during inspiration and expelled during the expiration. Formation of thoracic cage anteriorly by the sternum. Sternum is also known as breastbone because it overlies the breast. Posteriorly by 12 thoracic vertebrae and the intervening intervertebral discs, and on each side by 12 ribs and their cartilages. Now superior aperture or inlet of the thorax. The narrow upper end of thorax, which is continuous with the neck, is known as inlet of the thorax or superior aperture of the thorax. Boundaries anteriorly by upper border of manubrium sterni or manubrium sterni, posteriorly by superior surface of body of first thoracic vertebra. This is anteriorly upper border of manubrium sterni, posteriorly anteriorly by upper border of manubrium sterni, posteriorly by anterior border of superior surface of first thoracic vertebra, and medially and laterally by medial border of first rib, and also medial border of first costal cartilage. On each side of first rib with its cartilage on each side. Partition at the inlet of thorax. The partition is in two halves, right and left halves, with a cleft in between. Each half is known as substance fascia or suprapleural membrane. It partly separates thorax from the neck. The membrane is triangular in shape. Its apex is attached to the tip of transverse process of seventh cervical vertebra and the base to the inner border of first rib and its cartilage. Morphologically, the substance fascia is regarded as flattened tendon of scalenus medius of pleuralis muscle. Functionally, it provides rigidity to the thoracic inlet. This is the substance fascia. Attachment and relations. Superiorly, it is attached to the subclavian vessels, and inferiorly, it is related to the inferior surface is related to the cervical fascia, cervical pleura. And inferior surface is related to the cervical pleura. Inferior surface is related to the cervical pleura and the apex of lung. Superior surface is related to the subclavian vessels, and it is attached to the transverse process of seventh cervical vertebra, and it is also attached to the inner border of the first rib and the inner border of the costal cartilage. The superior surface of substance fascia is related to subclavian vessels, and its inferior surface is related to cervical pleura covering the apex of the lung. Structures passing through the thoracic inlet. The viscera, trachea and esophagus, apices of the lungs with pleura, remains of thymus. These are the viscera which are passing through the thoracic inlet. Large vessels, brachiocephalic artery on the right side, left common carotid and left subclavian arteries on the left side. You know, अभी आपने पढ़ा नहीं है आर्च ऑफ एओर्टा. आर्च ऑफ एओर्टा की तीन ब्रांचेस होती है. ब्रेकियोसेफेलिक आर्टरी ऑन द राइट साइड, left common carotid and left subclavian arteries on the left side. Then right and left brachiocephalic veins. These are the structures which are passing through the thoracic inlet. This is the trachea, this is the esophagus and the great blood vessels. Left brachiocephalic vein, right brachiocephalic vein, then brachiocephalic artery, left common carotid artery, left common carotid artery, left subclavian artery. And this is the diagram to show the structures passing through the thoracic inlet. Then the muscles related sternohyoid, sternothyroid, and towards the vertebral body, longus cervicis or longus colli muscle. Here, at the neck of the rib, structures related to the thoracic inlet, sympathetic chain, first posterior intercostal vein, superior intercostal artery, and first thoracic nerve. Nerves passing through the thoracic inlet, right and left phrenic nerves, right and left vagus nerves, right and left sympathetic trunks, right and left first thoracic nerves and muscles, sternohyoid, sternothyroid, and longus colli. Inferior aperture or outlet of thorax. The inferior aperture is the broad end of the thorax. It surrounds the upper part of the abdominal cavity but is separated from it by the diaphragm boundaries anteriorly infrasternal angle between the two costal margins. Posteriorly, inferior surface of body of 12 thoracic vertebra on each side, costal margin formed by cartilages of 7th to 12th ribs. Costal margin आप पढ़ेंगे which is formed by costal cartilages of 7th to 12th ribs. Structures passing through diaphragm. इसके लिए एक फार्मूला है वॉइस ऑफ अमेरिका. वॉइस से इंफीरियर वीना केवा, ओ से इसोफेगस और ए से एओर्टा. Inferior vena cava passing through the T8 level, esophagus passing at T10 level, and aorta passing through at T12 level. There are 3 large and several small openings in the diaphragm which allow passages to structures. Large openings in the diaphragm. Aortic opening is the osteoaponeurotic, lies at the lower border of 12th thoracic vertebra, T12 level, voice of America, T8, T10 and T12. T12 level पे aortic opening रहती है and it also transmits thoracic duct and azygous vein besides aorta. Then esophageal opening, it lies in the muscular part of the diaphragm at the level of 10th thoracic vertebra, voice of America, T8, T10 and T12. Esophageal opening lies at the level of T10 thoracic vertebra. It transmits, esophageal opening transmits besides esophagus, gastric or vagus nerves and esophageal branches of left gastric artery. Then vena cava opening of voice of America, T8 level, lies in the central tendon of the diaphragm at the level of 8th thoracic vertebra and transmits inferior vena cava and branches of right phrenic nerve. तो डायफ्राम में 3 मेन ब्रांच ओपनिंग होती है. वॉइस ऑफ अमेरिका से आप उसको याद रख सकते हैं. वीना केवल ओपनिंग T8 लेवल पे होती है, इसोफेजियल ओपनिंग T10 लेवल पे होती है और एओर्टिक ओपनिंग T12 लेवल पे होती है. वीना केवल ओपनिंग से मेनली इंफीरियर वीना केवा पास होता है, इसोफेजियल ओपनिंग से मेनली इसोफेगस पास होता है और वॉइस और एओर्टिक ओपनिंग से मेनली एओर्टा पास होता है. Important muscles of inspiration in diaphragm. Diaphragm receives its motor innervation from C3 cervical nerve, C4 and C5 spinal segments. Phrenic nerve. Because ये क्वेश्चन पूछा जाता है, why diaphragm receives its motor innervation from phrenic nerve? Diaphragm receives its motor innervation from phrenic nerve, that is C3, C4, C5 root value, because musculature of diaphragm develops from 3rd, 4th and 5th cervical myotomes in the region of neck. Why? Because the musculature of diaphragm develops from 3rd, 4th and 5th cervical myotomes in the region of neck. Intercostal spaces. These are the beta. Costi means होता है ribs. इंटर मतलब बिटवीन दी रिब्स, इंटरकोस्टल मतलब इंटरकोस्ट, इन बिटवीन दी रिब्स जो स्पेसेस रहती है उनको बोलते हैं इंटरकोस्टल स्पेसेस. These are the spaces between the ribs and their costal cartilages. The 3rd to 6th spaces are typical intercostal spaces because the blood and nerve supply of these spaces is only limited to thorax, while those of lower spaces extend into the diaphragm. Extend into the abdomen, sorry. Contents of typical intercostal spaces. three layers of muscle from superficial to deep. These are an outer external intercostal muscle, an intermediate layer internal intercostal muscle, and an innermost layer comprises of transversus thoracis muscle, also known as innermost intercostal muscle. कौन कौन से three layers of muscles हैं? From superficial to deep, these are an outer external intercostal muscle, an intermediate layer internal intercostal muscle, and an innermost layer comprises of transversus thoracis, innermost intercostal muscle. This is the diagram. Outermost is external intercostal, intermediate internal intercostal, and innermost transversus thoracis muscle. Transversus thoracis muscle के भी तीन पार्ट होते हैं बच्चों. Subcostalis muscle, intercostalis intimus muscle, and intercostalis intimus muscle, and sternocostal muscle. एक्सटर्नल इंटरकॉस्टल मसल का डायरेक्शन और इंटरनल इंटरकॉस्टल मसल का डायरेक्शन, दोनों के डायरेक्शंस परपेंडिकुलर होते हैं. एक रहता है डाउनवर्ड्स फॉरवर्ड्स एंड मीडियली, एक इंटरनल एक्सटर्नल इंटरकॉस्टल डाउनवर्ड्स फॉरवर्ड्स एंड मीडियली, और एक होता है डाउनवर्ड्स फॉरवर्ड्स और डाउनवर्ड्स लेटरली एंड आउटवर्ड्स, एक्सटर्नल इंटरकॉस्टल एंड इंटरनल इंटरकॉस्टल. नाउ in between the internal intercostal muscle and intercostalis intimus muscle, there lies the neurovascular bundle of the space, which is remembered by formula VAN. 1. Intercostal vein, intercostal artery, and intercostal nerve. This lies between the intermediate layer and innermost layer of this particular space in the costal groove. Intercostal vein, intercostal artery, and intercostal nerve. VAN. External intercostal muscle, internal intercostal muscle, intercostalis intimus muscle. You can very well see that the intercostal vein, intercostal artery, and intercostal nerve, VAN. This structure lies between the internal intercostal muscle and intercostalis intimus muscle. From superficial to deep, the thoracic wall, skin, superficial fascia, deep fascia, then muscles, then pectoralis major muscle, then external intercostal muscle, then internal intercostal muscle, then intercostalis intimus muscle, then endothoracic fascia, then costal or parietal pleura. This is the structure of thoracic wall from superficial to deep. This is the origin and insertion of the intercostal muscles. ये आप पढ़ लीजिएगा आपकी बुक में से. एक्सटर्नल इंटरकॉस्टल मसल, इंटरनल इंटरकॉस्टल मसल एंड ट्रांसवर्सस थोरेसिस मसल. मैंने बताया आपको ट्रांसवर्सस थोरेसिस मसल जो है ये इंटरकॉस्टेलिस इंटीमस मसल है. इसके तीन पार्ट्स होते हैं, सब कॉस्टेलिस मसल, इंटरकॉस्टेलिस इंटीमी मसल एंड स्टर्नोकॉस्टेलिस मसल. External intercostal muscle is supplied by intercostal nerve of the same space and it helps in inspiration. Internal intercostal muscle is supplied by intercostal nerve of the same space and it is supplied by intercostal nerve of the same space, and intercostalis intimi muscle is also supplied by intercostal nerve of the same space. There are 11 intercostal spaces on each side because there are 12 thoracic, there are 12 ribs, so there are 11 pairs of intercostal spaces on each side. So external intercostal muscles are present in 11 pairs Internal intercostal muscles are present in 11 pairs, and intercostalis, intimi, subcostalis, and sternocostalis. These are restricted to some pairs of the intercostal spaces. External intercostal muscle, major part is fleshy. Anteriorly, anteriorly at the costal cartilage, it is replaced by anterior intercostal membrane. External intercostal muscle, it is anteriorly at the costal cartilage, it is replaced by the anterior intercostal membrane, which is an aponeurosis. And internal intercostal muscle, posteriorly it is replaced by the posterior intercostal membrane, which is aponeurosis. Intercostal nerve and intercostal vessels and lymphatics. Between middle and internal intercostal layers, intercostal muscles. Between middle and innermost layers of intercostal muscles, that is between internal intercostal and transversus thoracis, lies position of neurovascular plane in the thoracic wall, जो कि मैंने आपको बताया intercostal vein, intercostal artery and intercostal nerve. Neurovascular bundle, intercostal vein, intercostal artery and intercostal nerve. Mnemonic है उसका vein, VAN. Intercostal vein, intercostal artery and intercostal nerve. Typical intercostal nerve. The typical intercostal nerve arises by two roots, anterior and posterior from the spinal cord. Typical intercostal nerve, there are 12 pairs of thoracic spinal nerves. You know this fact very well. The typical intercostal nerve arises by two roots, anterior and posterior from the spinal cord, which enter the intervertebral foramen, where they unite to form the spinal nerve. They unite in the intervertebral foramen, where they unite to form spinal nerve. After emerging from the intervertebral foramen, each spinal nerve divides into two rami, a large anterior ramus and a small posterior ramus. Large anterior ramus and a small posterior ramus. This is the diagram. The anterior ramus, anterior root and posterior root. In the intervertebral foramen, nerve trunk is formed. Then this nerve trunk is divided into large anterior ramus and small posterior ramus. The anterior ramus, also known as anterior primary ramus, is known as the intercostal nerve. There are 11 pairs of intercostal nerves on each side in 11 pairs of the intercostal spaces. The branches of the intercostal nerves are communicants branch, gray rami and white rami, then lateral cutaneous branch and anterior cutaneous branch. अब ठीक है, the anterior primary rami of the upper 11 spinal nerves form the intercostal nerve. बेटा there are 12 thoracic nerves, लेकिन हम जो बोलते हैं 11 thoracic spinal nerves को ही बोलते हैं intercostal nerves. The 12th anterior primary ramus is known as thoracic spinal nerve. So thoracic spinal nerve forms the subcostal nerve, क्योंकि 12th rib के नीचे कोई rib नहीं होती है. So therefore it is known as subcostal nerve. Typical intercostal nerve are the anterior primary rami of 3rd, 4th, 5th and 6th thoracic spinal nerves, because they are restricted to their own spaces. First anterior primary rami takes part in the formation of brachial plexus C4, C5, C6, C7, and C8. And C8 and T1 takes part in the formation of brachial plexus. T2 is intercostobrachial nerve, takes part in the T2 supplies the medial part of the arm, and T7 to T12 supplies the abdomen. So they are not the typical intercostal nerves. So typical intercostal nerve are T3, T4, T5 and T6 only. They supply the thoracic wall. The anterior primary rami of T1 and T2 supply upper limb, and those of T7 to T11 supply the abdominal wall. Therefore, intercostal nerves in the upper 2 and lower 5 intercostal spaces are atypical intercostal nerves. A typical intercostal nerve at the beginning of its course, the nerve crosses behind the intercostal vessels, intercostal artery and intercostal vein, and then runs below them. Branches of intercostal nerve, rami communicants to the sympathetic trunk, white rami to the sympathetic ganglion, and gray rami from the sympathetic ganglion to the ventral ramus or anterior primary rami. Collateral branch supplies the intercostal muscles and lateral cutaneous branch. Anterior cutaneous nerve, terminal branch and muscular branches to intercostal muscles. जैसा कि मैंने आपको बताया, intercostal nerve supplies the intercostal muscles of the space, and external intercostal muscle, internal intercostal muscle of the space. Movements take place during the respiration. Increase in transverse diameter of thoracic cavity occurs due to bucket handle movement of 7th to 10th ribs mainly. The ribs articulate in front with the sternum and behind with the vertebral column. Since the ribs curve downwards as well as forwards around the chest wall, they resemble bucket handles. Therefore, the ribs are raised like the bucket handles, and bucket handles, the transverse diameter of the thoracic cavity will be increased. The increase in antero-posterior diameter of thoracic cavity, the anterior ends of the ribs are lower than the posterior ends. Therefore, during elevation of the ribs, anterior ends also moves forwards, leading to increase in antero-posterior diameter of thoracic cavity. Along with up and down movement of ribs, the sternum also moves up and down. The sternum also moves up and down like pump handle movement. बेटा ये सब मूवमेंट्स के कारण इंट्राथोरेसिक वॉल्यूम बढ़ता है. बकेट हैंडल मूवमेंट होता है जो रिब्स का होता है, और पंप हैंडल मूवमेंट जो होता है ये स्टर्नम का होता है. ट्रांसवर्स डायमीटर बढ़ता है रिब्स के कारण, और एंटेरो पोस्टीरियर डायमीटर बढ़ता है स्टर्नम के कारण. और जब इंट्राथोरेसिक वॉल्यूम बढ़ेगा तो निगेटिव इंट्राथोरेसिक प्रेशर लंग्स के अंदर एक इंट्राथोरेसिक कैविटी के अंदर जनरेट होगा. जब इंट्राथोरेसिक कैविटी के अंदर थोरेसिक कैविटी के अंदर निगेटिव इंट्राथोरेसिक प्रेशर होगा तो एयर सक्ड इन होगी और इंस्पिरेशन होगा. ऐसे ही इंक्रीज इन वर्टिकल डायमीटर होगा तो ये होगा ड्यू टू डिसेंट ऑफ डायफ्राम. ये डायग्राम आप जरूर बना लीजिएगा टिपिकल इंटरकोस्टल नर्व का. हम पोस्टीरियर प्राइमरी रेमस और डॉर्सल रेमस को इंटरकोस्टल नर्व नहीं बोलते हैं. हम एंटीरियर प्राइमरी रेमस और वेंट्रल रेमस को इंटरकोस्टल नर्व बोलते हैं, because it is longer and it is larger and it is present in the intercostal space. और इंटर न्यूरोवास्कुलर बंडल में, न्यूरोवास्कुलर बंडल जो रहता है उसमें स्ट्रक्चर्स कौन कौन से प्रेजेंट रहते हैं? इंटरकोस्टल वेन सबसे अबोव, देन इंटरकोस्टल आर्टरी बीच में, और इंटरकोस्टल नर्व एंड बिलो. A few words regarding the intercostal arteries. एंटीरियर इंटरकोस्टल आर्टरी प्रेजेंट रहती है, पोस्टीरियर इंटरकोस्टल आर्टरीज प्रेजेंट रहती है. एंटीरियर इंटरकोस्टल आर्टरीज आर द ब्रांचेस ऑफ द इंटरनल thoracic artery. Anterior intercostal artery are the branches of internal thoracic artery, and internal thoracic artery is the branch of subclavian artery. Remember, internal thoracic artery is a branch of subclavian artery, and anterior intercostal artery is branch of internal thoracic artery. Similarly, posterior intercostal arteries are branches of the descending thoracic aorta. Posterior intercostal arteries are the branches of descending thoracic aorta. In the first two intercostal space, posterior intercostal arteries are the branches of superior intercostal artery, which is the branch of costocervical trunk from subclavian artery.